In this presentation, we will discuss how to build your foundational capacity. The Practical Playbook was developed as a collaboration between Duke University and the Du Beaumont Foundation. The link to the playbook is on the screen and will also be listed on the online course. The Practical Playbook is an important resource for you. It contains strategies organized across 5 categories: organize and prepare, plan and prioritize, implement, monitor and evaluate, and sustainability. We work closely with playbook investigators to identify strategies that promote foundational capacity. The mission of the playbook is to advance collaboration among public health, primary care, and others to improve population health. We do this by providing practical implementation tools, guidance, and resources. Their vision is for public health, primary care, and others across the United States routinely engage in robust, sustained, and effective collaborations. Working together, they achieve extraordinary gains in the health and well-being of people and their communities. What are some practical things we could do to build our foundational capacity? Let's now discuss the types of strategies that can build across these capabilities. One thing to remember is that if you choose to work on building foundational or on energizing capacity, work on the suggestions I'm about to talk about on this slide instead of focusing hard on a specific quadrant as we discussed in the previous modules. I'd also like to remind you that these suggestions are a mix of feedback from practitioners and stakeholders, as well as items outlined in the playbook. So first, connecting on key programs with existing resources to build relationships and understanding. So in other words, start collaborating on a program or area that is of mutual importance and may already have resources. For example, immunizations. It can be tricky, though, to identify whose resources are in play. For example, public health may be the base of this program example. In another example, primary care might have some resources to leverage around working with diabetes care for specific populations. Or a primary care site might have effective ways of screening for hepatitis C, and the public health department may have good ways of doing outreach for these topics. Really strategize regarding where the resources and leverage points are. 2. Support the idea of public health as a neutral convener and the possibility of tackling health issues on a regional focus. Use or think of public health as this neutral convener who can work across systems. 3. Identify areas of synergy. What can be done better together? What are areas of mutual high priority? 4. Create ongoing communication channels and the right mix of approaches. For example, in Minnesota, one local health department director assigned her public health nurses to specific clinics. The nurses treat these clinics like a client. They're responsible for these clinics and are expected to stay in touch and be regularly engaged with them. That might mean going out of both office settings once a month for coffee or drinks or lunch. Figure out what warrants an email or call versus just regularly getting together and staying in touch. 5th, align leadership, and that goes beyond just the scope of a specific program. This requires an ability to clarify roles, ensure accountability, and the capacity to initiate and manage change. If you are having ongoing communication channels, then you have people maintaining this. This may be the highest level for some. And this may be a goal, but aspirational goal, and that's fine, but continue working towards it. As you can see in the example above, we have worked with Practical Playbook staff and various state and local stakeholders to crosswalk key study findings with strategies available in the Practical Playbook. We'll now walk through 3 example areas to give you a better sense of what you can do to build your foundational capacity. Take a moment to review this screen for the 3 categories: align leadership, build trust and respect, and create a shared vision. Review the column on the left, which gives you ideas during each phase: organize, plan, monitor, sustain, and overall tenets. I'll take a small pause right now so you can read this chart. We will now talk about each section in detail. Let's start with aligning leadership. This is one place where you can use public health as a neutral convener and bring in leadership from both or many organizations to start thinking about shared goals and vision. A great starting place is with key programs for both. Perhaps it relates to emergency response or immunizations. Maybe it's a screening program. But where do you have existing resources that can be built upon? A fundamental piece of building a foundation relates to communications. Think about how to create ongoing communication channels. Likely there will be more than one used, and you will figure out when email, meetings, phone calls, or a combination of the above works best. As you monitor this aspect of relationships, consider who is missing and how could you fill those gaps. No relationship is sustainable without building mutual trust and respect. While that seems obvious, many forget that you can be strategic about building those relationship aspects. Consider sitting down for coffee, lunch, dinner, drinks, whatever works best for you. One-on-one and community-based opportunities are important. Put the personal relationship into your collaboration. A key point raised by stakeholders from both sectors relates to putting your own self-interest on the table and consider other opinions when prioritizing. Another obvious piece of trust relates to following through on what you say that you will do. Keep in mind that actions usually speak louder than words, so if you're promising a lot but not able to deliver, you will erode trust in the relationship. Partners bring different interests to these relationships. Where do they align and where do they disagree? What can you do to bring them into alignment, and what do you let go? These are pieces of monitoring and evaluating your relationship building, and you may have to make some adjustments based on what you see. Finally, make sure to take some time to celebrate your achievements. Give all partners visibility in the community for these successes and look for early wins. This is hard work, and everyone needs opportunities to feel that your work to date has been worth it. Creating a shared vision is critical for staying on course and working towards shared goals and objectives. Early on, it's important to look for those areas of synergy where you do already share mutual priorities. But it's okay to look beyond those and raise priorities that are important to your organization. Perhaps you will persuade your partner that it's in their best interest to tackle a specific health topic or issue together. Creating a written vision statement with a logic model and work plan as appropriate helps make this step more official and gives you a tool that you can work from as you go together. Along with this step is the concept of branding your work. What's the identity of your collaboration? Promote it, work with it, and use it to further your partnership. As you pause to evaluate your effectiveness within creating a shared vision, you simply need to refer back to the work you achieved and see how well it lines up with fulfilling that mission. It is at this step that having a logic model is very helpful. In terms of sustainability, the buzzwords are return on investment, how do you measure success, and what needs to be done organizationally to support this work moving forward. Overall, the point of a shared vision is reaching consensus across your partners and working together towards shared goals and objectives. What do you envision for the health of your community based on your partnership and work together? In the next section, we'll discuss building an energizing capacity.